Hey everyone, Dana from Peaceful Living. I don't know why my voice is so loud and shrieky, sorry. So on our last video, we talked about dissociation. And as we kind of chatted about, not like we had a conversation because this is me just talking at a camera, but you know what I mean? So as we mentioned, dissociation is a way to just survive the present moment. If the present moment, meaning a stressful time during a trauma, if the present moment was so overwhelming, we can disconnect from reality or disconnect from our body as a way to survive. That being said, as we mentioned, once our brains dissociate, they can continue to dissociate. So we want to really teach clients how to learn how to stay present before we can really do any effective reprocessing with EMDR. So that being said, one of my favorite resourcing tools to use with dissociation is the CIPOS method from Jim Knipe. So CIPOS is C-I-P-O-S, and it stands for Constant Installation of Present Orientation and Safety. So basically what this means is that we are helping to tone down the dissociation in our clients by strengthening their ability to stay present. So I'm just gonna kind of model how to use this, this resource. With anything that you're using with a client, you first want to obtain permission. So when we work with especially structural dissociation, a lot of parts work, we want to address the client. And by this point, you've probably had the parts conversation with them. You know, we often use it in our language. A part of me feels this, a part of me feels that. So we just want to get permission from all of a client's parts to proceed with this intervention. That's our way to honor all of the parts and to acknowledge them, because integration is all about co-consciousness of the parts. So we first obtain permission and we give them psychoeducation and an understanding of why we're doing this. So by this time, we've given them information on dissociation and explained all about it, why we dissociate and so forth. And then we kind of, I always say kind of, I hate that, it's so annoying. So then we, trying not to say kind of now, then we describe to them how we use this method. So really how it works is we're going to address all of the, address things in the room, in the present, and strengthening that with bilateral. Jim Knipe says in his description to do eye movements. I find with clients sometimes the tactile is helpful, especially if you have the wireless ones, which I love. EMDR, what am I thinking of? There's, someone sent me a message and I'll tell you the one I'm thinking of, but there's wireless ones, it's not neurotech. So you can hold the buzzers or you can teach them a butterfly hug. You know, we're in the middle of coronavirus quarantine right now. So the tapping is something that we're all getting used to as we do virtual EMDR. So how do you use CIPOS? So you give the client the description, you give them permission, and then you ask them, you say, you know, notice something in the room. Notice that pillow over there. What do you think of that pillow over there? It's pretty. Notice that. And then install that in. What do you think about that lamp over there? Notice that. You're not bringing up any traumas at this point. You're just strengthening their ability to stay present, right? Because what we know about dissociation is at one time not being present was really helpful. So notice the color of that curtain. What color is that curtain? Oh, it's navy blue. Okay, notice that. And so you're just strengthening their ability to stay present. Another option that you can use if a client's having a hard time with it is you can play catch with them. So just kind of notice the part of you that's catching, or do all your parts, or is everybody kind of on board? Catching back and forth. Playing a game of catch has actually been proven to dramatically and quickly decrease symptoms of derealization. So it brings them back into the present moment. Once you see that a client is more grounded, you could start titrating, right? So it's all about pendulation. So you just slowly want to go in. It's kind of similar to the flash technique. So you're going to say, okay, now what I want you to do is just think of, quickly, you're going to let them know it's going to be brief. Briefly think of the car accident, or briefly think of, you know, when your mother was screaming at you as a kid. And just notice that. And we're only going to do it for a few seconds. You can count for them so they know. Okay, just notice that image of your mother screaming, 1, 2, 3, and then back into the room. Notice that lamp over there. Go with that. Notice the pillow. What do you think of that? Notice that. So you're just slowly getting them ready to go into a trauma. This is really effective for clients who have a tendency to loop, for clients who have a tendency to get overwhelmed or have that dissociative abreaction. So this is a really nice way to teach grounding, to teach the ability to stay present and strengthening that mindfulness. So I hope that's been helpful. Again, it's the constant installation of present orientation and safety. It's from Jim Knipe. You can check out his book, which is EMDR Toolbox. It's something I use frequently in my practice. And again, if anyone has any questions about specific cases, I am offering consultation. I'm a consultant in training, so I'm offering low-cost consultation to anyone who needs help in their EMDR practice. 15 of the 20-hour requirement for certification. You can do 15 of those hours with me. Or you could also check out our EMDR services in our practice at peacefullivingmentalhealthcounseling.com. Hope you guys are doing well. Stay safe. Bye.